I will now show you the legacy examination. All right. So this is an example. So this is your candidate name. Of course, you have to put your name here. Normally, when you do your implementation station, before you start, the assessor would tell you to write your name. So again, for this station, you are using a black pen. Okay. So the note for the candidate or the instruction. So the assessor will read you this the following notes. So the number one is talk to your patient. Please verbalize what you're doing and why. Read out the chart and explain what you're checking, giving, not giving, and why. Complete all required drug administration checks. Complete the documentation and use the correct codes. The correct codes are on the chart and on the drug trolley. So on your examination, you will find the codes at the back of this paper. And of course, it will be on the drug chart. Okay. And the medications there are arranged alphabetically. Okay. So do not find your amlodipine at the bottom of your drug chart. It should be at the very first row. Next is to check and complete the last page of the chart. So it's part of your 15 minutes. Okay. Documentation is part of your 15 minutes. And you have 15 minutes to complete the station, including the required documentation. The examiner will retain all your documents at the end of the station. So this is an example of a scenario. So Joe has now settled and his breathing has improved. Joe had some breakfast and now due to have all prescribed medications. Please administer and document Joe's 8 o'clock medications safely and in accordance with the NMC standards. So complete all sections of the document, assume it is today, and it's 8 o'clock in the morning. Okay, so based from the scenario, that means you're meant to administer all Joe's medication in the morning or at 8 o'clock. Okay, so you will start by reading this. So of course, let's just recap before I start reading this. So of course, scene is safe, wash your hands, introduce yourself. So your name, your role, the reason of your visit. So I'm here to administer your 8 o'clock medication. Gain consent. Will that be all right, Joe? If the patient said yes, then you carry on. Then after that, you could also ask the question if the patient has any problems with swallowing. Of course, you can only administer, I mean, you cannot administer oral medications if the patient cannot swallow or the patient has dysphagia or has any troubles with swallowing. Of course, you have to find alternatives, okay? But most likely, the patient is able to swallow in your examination because, of course, you cannot proceed. So what are the possible medication that you might be administering on the examination? So medications except IM medication, subcut, inhaled medication, and controlled medication. Okay? And why are we not giving those here? Because you have a separate station for those. So you are not expecting to see, let's say, a medication that will be given intramuscularly on this station. Okay? You will not see any medication that you will be given subcutaneously on this medication. So you're also not expecting to see or administer inhaled medication on this station. You may see an inhaler prescribed, but most likely patient will not need it at that moment. All right. Also, medications requiring you to administer or optical or optic and otic. So there are no medication. I think if you've seen the example on the online marking criteria or the online mock examination, there is I think an example for optic or an eye drops. Okay, so far there is none. But again, you'll never know. They might add it in no time. But it may be a skill. Okay, it may be a skill. Administration of, let's say, eye drops. Okay, that's it. But so far, what we know, there is none. And even controlled medication. So in the UK, you need to get assessed first. Okay, you need to get signed off prior to giving controlled medication. So for your OSCE again, they are treating you as a newly qualified nurse. So they will not give you too complicated scenarios. Okay, so let me start reading. So for the first page, you have to read it fully. So prescription chart for Joe Rizal. The patient is male. Admission date is today. Admitted at 6 o'clock in the morning. Hospital numbers 1, 2, 3, 4, 5, 6, 7, 8, 9. The date of birth is the 10th of the 4th, 1941. And the patient's address is Reading, RG2, 5TH. And the patient's ward is awkward. Okay. And the patient's allergy, the patient's allergic to peanut and plaster. The type of reaction is anaphylaxis, signed by Dr. Strange, bleep number 123. The date is today at 7:05 in the morning. So the information for prescribers and information for nurses administering medication, it's there and it's readily available. Okay, I will stop there. So Emmer, you mean to say we don't need to read everything? Of course, you don't need to read all the codes. But the most important thing that you have to do is to remember what the codes are. Okay, you don't need to memorize it, but you know the codes by heart. So probably after a couple of practice, you will eventually remember all the codes. For the old examination and for the new examination, you have different codes. Okay, you have different codes. So please do not compare codes because you might end up failing the examination too because you might get confused. Okay, so these are the codes for the old test of competence. So before I carry on, let's just break down the codes. So number one, if the patient is not on the ward. Number two, if the medication you're about to give will be omitted for a clinical reason. So the clinical reason might be similar to, let's say, omitting because of, let's say, the blood pressure of the patient is really low. Let's say digoxin, you might not give this because the patient's heart rate is too low or less than 60. So those are the possible reasons or clinical reasons. Number three is your medicine not available. So Emmer, could that happen on the examination? Yes, it may happen. So please do remember code number three. Number four, remember on our discussion for the patient's rights, patient refused patient refusal is also a medication right. So in case the patient is actively refusing the medication, of course you have to honor that. But again, prior to like giving up, you have to explain the repercussions or you have to explain what the medication is for so that the patient could understand it. But if everything fails, you have to again document and of course escalate that accordingly. Number five, if the patient is, let's say, vomiting on or nauseated, of course, for obvious reasons, you may not be able to administer medications for this instance. Number six, if the medication or the prescription is incomplete or wrongly prescribed medication. So that means if on the examination your drug chart or your prescription is incomplete, you cannot give it. Okay. Number seven, nail by mouth, of course. Number eight, no intravenous access. And number nine, for others. So, Emmer, there is nothing mentioned about the patient's allergy. So, what if the patient is allergic to something? There are three possible answers for that. Answers or the codes for the allergy might be the following. Number two, because omitted for clinical reason. The reason is definitely the patient is allergic to it. Number six, can we also consider that the prescription is incorrect? Or wrongly prescribed, of course. So number six, you could also use number six to indicate that the patient is allergic to that. And of course, number nine, others. Okay, others. But again, guys, for the new test of competence, you have different codes. We will be discussing it in a few. So are we all happy with the codes? So guys, please do remember the codes. You don't need to memorize it, but remember it by heart. Okay. So the bottom part of this page is you have to read it again. So does the patient have any documented allergies? Of course, yes. The ward is awkward. Consultant is Dr. Strange. Any special dietary requirements? Yes. The patient's height is 165 centimeters. The patient's weight is 13 stones or 83 kilograms. And the patient's BMI is 30.49, low sodium diet. Okay. So that is your bottom part of this chart. So let me just give you a tip, guys, for this part. So the weight. So we all know that we need the patient's weight before administering the medication. So for the doctor to determine the appropriate dose and the dosage of your medication. So when we talk about dose and the dosage is the strength of your medication and the frequency of administering the medication. So please do remember for paracetamol in the UK, 1 gram every 4 to 6 hours. But please do remember the weight. If the patient's weight is below 50, you cannot give the full dose, which is 1 gram. Okay? You cannot give the full dose, which is 1 gram. So going back to our previous webinar, we learned that the maximum dose of paracetamol in a day is 4 grams. Okay? So if you're going to give the paracetamol round the clock, so it should be every 6 hours only, and the maximum dose is 4 grams a day. Okay? But for PRN, of course, you can give it 4 to 6 hours, but do not exceed the maximum or the limit, the maximum dose, which is 4 grams a day. So any questions so far? So please remember your paracetamol, and it may be a trick on the examination. Okay. So second page, any question with regards to the first page? You're happy with this, yeah? Second page, the prescription chart for Joe Rizal, male. So at this point, you don't need to read the rest of the details. So you only need to say that the rest of the details are the same, and I'm happy to proceed. So because if you're reading everything again, you may run out of time. But make sure you just read that the prescription chart is for Joe Rizal, okay? Prescription chart for Joe Rizal, and the rest of the details are still the same, and I'm happy to proceed. Okay, let's start with your once only in stat doses. So the date is today, the time is 6:30. The drug name is ibuprofen. The dose is 200 milligrams. The route is per orem. Signed by Dr. Khan, beep number 123. Given by LW, checked by AC, time given at 6:35. Okay, so based on, let's analyze this prescription. So based on this table, it means you are not meant to give this medication because this medication has been given. Okay, it was already been given by AC, and it was checked by given by LW and checked by AC. It was given 6:35 in the morning. Okay, so Emmer, question for once and only stat doses. Will there be an instance wherein we might administer a once and only stat dose? Of course. Okay, of course. They might be an instance wherein you might be giving a stat dose. All right. So I will give you an example later. Okay, we will go back to this part later. Next is prescribed Medicaid oxygen therapy. The date is today. The time is 6:15. Prescribed by Dr. Strange, bleep number 123. Target oxygen saturation is 94 to 98%. Instructions is to maintain saturations as per target. The device is Venturi mask. The flow is up to 40%. The time 6:20, started by JK and discontinued 7:45 by JK. So if we analyze this prescription, that means the oxygen has now been stopped. Okay. So when you reach this section, you may ask the question, assessor, may I please know the patient's current saturation? So similar with your blood pressure in my example earlier, you don't have to actually perform the saturation or check the patient's saturation. You only need to ask the assessor for any information you may require about your patient. Okay, so you could ask the patient's respiratory rate and saturation at this point. Okay, any questions so far? So remember, guys, when you're dealing with your prescription, you have to read everything. Not everything, but yeah, the most important things. So any questions so far with our oxygen? PRN, so as required medication. So the first medication is today. The drug is ibuprofen. The dose is 400 milligrams. The route is per orem. Instruction is 6 hourly for arthritic pain. Signed by Dr. Strange, bleep number 123. So this prescription is correct and complete. So remember, you have to talk to your patient. So how will you know that the patient is still in pain? So we go to our patient. Oh, you talk to your patient, to Joe. So Joe, I can see that you have your painkiller here, your ibuprofen for arthritis. Are you experiencing pain at the moment? Let's say the patient said, oh yes, nurse, I'm still experiencing pain. So how would you rate your pain from 0 to 10? 0 without pain and 10 being the highest possible pain. Oh, nurse, really painful. Is this around 6? Oh, I can see that you're still in pain. I'm Joe. So this is my question for you guys. Are we giving the ibuprofen now or we cannot give it at all? Type your answer. Okay? Based on this prescription, are we giving the ibuprofen or not?
Yes.
Yes, yes, yes. I want to see more answers. Yes.
No.
No. Who said no? Are we giving it or not? If today is your examination, let's see if you're going to pass. Someone said no. Okay, you
No,
might be thinking,
because I will check first the next drug medication because it might be given in the regular ones.
well done, well done. But this medication might be written on your regular medication, which is correct. Okay, so before offering your PRN, probably you could tell the patient, so before I administer this ibuprofen, Joe, I will just carry on reading the drug chart, the rest of the drug chart, because something might be prescribed for your pain. Will that be all right? Okay, so that is correct. But there's another one. The main reason why you're not giving the ibuprofen, because if you go back to the first part of our drug chart, look at this. Can you all see the ibuprofen? Exactly. Well done. So, is that the ibuprofen was just given 6:30 in the morning. Okay. So, if we analyze the scenario, we are now at 8 o'clock. So, the ibuprofen was just given 1.5 hours ago. So, for the people who said yes, if today is your examination, you failed the exam. Yeah. So, be careful. So, the technique for the PRN is, they say there's something here on the PRN. You go back to your stat dose, make sure that there is nothing written there, or and no any like duplication of the medication. And then before giving your PRN, you have to check the remainder of her drug chart. Okay, so that is your technique when you're offering or giving your PRN. So check the PRN. If it's a correct prescription, go back to your once and only stat doses medication. Check if it was given a while ago or couple of hours ago. If not, check the remainder of your drug chart. Okay, are we all happy with that? So that is one of the techniques on the examination. Like, so we have couple of scenarios wherein you might see this particular scenario. Okay, not the same medication, but similar similar drama. So let's carry on. So temazepam. So today, temazepam, the dose is 10 milligrams. The root is 10 mil. Temazepam, the dose is 10 milligrams. The root is per orem. Instruction is night sedation only. Signed by Dr. Strange, bleep number 123. So this prescription is also correct and complete, but for obvious reasons, we are only giving the temazepam at night. Remember, we're only at 8 o'clock in the morning. So just tell the patient, probably as part of your conversation. So Joe, in case you need this medication, please do let us know so we could give it later tonight. Okay? So because you don't want the patient to sleep all day. So next page. So similar with the second page, you don't have to read everything. Just simply say the prescription chart for Alex, not Alex Smith. Sorry, I forgot to change my drug chart. It's Joe Rizal, yeah? Joe Rizal. It's Joe Rizal, and he is male. And all the patient's details are still the same, and I'm happy to proceed. For antimicrobials, I can see that there is nothing prescribed, okay? So guys, even if there is nothing prescribed, you have to say it out loud, because remember, on the instruction, you have to read the drug chart fully. So we carry on. Next page is the prescription chart for Joe Rizal. Again, patient's male, and the rest of the details are still the same, and I'm happy to proceed. So the first regular medication is your digoxin. So the date is today, the dose is 125 micrograms, frequency is once daily, the route is per orem, the duration is ongoing, the start date is today, the finish date is ongoing, signed by Dr. Strange, bleep number 123. Is correct, complete, and it's due your time. Remember, we are giving the 8 o'clock medication. So can we give this medication? Are we giving this medication or not? Yes. Okay. Benjamin, yep, I can see a couple of yeses. Well done. Have to ensure that the patient's heart rate is within the normal range. Okay. So of course you're not giving the digoxin if the patient's heart rate is below 60. So what's the next step? You ask the assessor. So assessor, may I please know the patient's current heart rate, please, or the pulse rate. So if the assessor said it's within the normal range, then we carry on. So sometimes on the examination, they might give you a value, or sometimes the assessor will just tell you it's within the normal range. Are we documenting at this point? We will document everything at the end. Do we need to dispense the medication each time we're reading it? No. Dispensing of the medication will be done at the end, similar with your documentation. Everything will be done at the end. Okay? So that is your digoxin. Second medication, furosemide. The date is today. The dose is 40 milligrams. The frequency is once daily. The route is per orem. Duration is 5 days. Start date is today. The finish date is ongoing. Signed by Dr. Strange, bleep number 123. This medication is correct and complete, and I'm happy to proceed. What will be my next question from the assessor? ask the blood pressure, of course. So remember, furosemide, when you explain this medication, so let's say, Joe, this medication is a diuretic. So in the UK, normally people, they know diuretic as your water tablet. Okay, so if one of your patients said, "Oh, that's my water tablet," they're referring to your diuretics. Okay, so the most important thing that you have to ask prior to giving this is the patient's blood pressure. Okay, the patient's blood pressure. Of course, as assessor, may I know the patient's current blood pressure, please? Of course, if they said within the normal range, you can administer it, okay? Or they might give you a value. Remember that furosemide, its main indication is not for blood pressure. It's a diuretic, okay? Remember that the patient's drop in blood pressure is a side effect. So number 3, rivaroxaban. I think it's part of our quiz earlier, so you know this by now. So rivaroxaban, the date is today. The dose is 20 milligrams. The frequency is once daily. The route is per orem. The duration is ongoing. The start date is today. The finish date is ongoing, signed by Dr. Strange. It's correct prescription and complete, but it's not due my time yet. Okay, so remember, we are only administering the 8 o'clock medication. So you can tell the patient, this medication is not due yet. So this medication is your blood thinner. Okay, so that as simple as that, your explanation. Any questions so far for this page? That should be pretty much easy. Okay. Next page. I think this might be our last page for the old drug chart. So next is prescription chart for Joe Rizal. All the details are still the same. For intravenous fluids, nothing is prescribed. And that ends my drug chart. So as a tip, guys, before you carry on, you do a summary. Okay. So Emmer, could we always go back to our drug chart? Of course. Okay. You could always refer back to your drug chart in case you need to recheck. So talk to your patient. So Joe, the medications that I will be giving you are the following. So I will be giving your um, digoxin. I will be giving your furosemide, those 2 medications only. Unfortunately, Joe, I cannot give your painkiller yet, your ibuprofen, because it was given an hour and a half ago. So what I'll do is I'll ask the doctors if they could prescribe something for your any alternative medications for your pain instead. Okay, so make sure to reassure the patient that you're doing something. Remember, for the ibuprofen, probably its effect will peak at some point, but of course you have to honor the patient's um, pain. And of course, you have to escalate that to the doctors in case you want to give something for the patient. Of course, a pain score of 6 out of 10 is kind of painful. Yeah, it's moderate pain. So don't tell the patient that, "Oh, Joe, let's wait for 5 more hours before we give your ibuprofen." So on the examination, okay, this is our little secret. So on the examination, normally you will just give 2 or 3 medications. Okay. If you have 6, you prepared 6 medication in your examination, there might be something wrong. Okay. If you're only giving 1 medication, double check your drug chart. Okay. Sometimes it's 2 to 3. That's our little secret on the examination. After this, you go to your drug chart and then you prepare your medication. So make sure before dispensing the medication, you have to check the expiration of the drug, the integrity of the bottle, if it's clean, dry, and intact. Of course, do not forget to wash your hands before and after preparing the medication. Okay. So, Emmer, question: what if I drop a medication? Where will I discard the medication? Sharps bin. Do not discard the medication in a regular bin. Okay. Do not discard your medication on a domestic bin, but discard it in the sharps bin. So well done. Another question, Emmer, is: do I need to prepare the medication in individual cups, or can I prepare everything on 1 cup only? So it's either. Okay. It's up to you if you want to prepare everything in 1 cup only or on separate cups. The only downside if you're preparing it in 1 cup only is, what if you then realize that, oh, the patient is allergic to penicillin and I prepared penicillin. So of course you will not know which one is which. Okay. That's the only downside. But again, it's up to you whether you want to prepare everything single cup or in multiple cups. So let's pretend we go back to our patient and we administer the medication. So Emmer, I have a question. Do we need to check the patient's identity once again? Oh, Paulina, Paulina mentioned this. All right. So that's a good question. So On the examination, on your marking criteria, it's only asking for the patient's identity once. Okay? If you're only checking the patient's identity once, that is enough. Okay, that is enough. Because on the marking criteria, have a look. If you have any marking criteria in front of you, it's only asking for you to check the patient's identity once. Why? Because you are not leaving the patient on the examination. Okay, so on the examination, the patient is beside the drug trolley. So of course, that is your same patient. Okay, in real life, okay, in clinical practice, before we give the medication, we do a second check. Okay, that's what we normally do in clinical practice. So, Emmer, what if I recheck the patient's identity again? Of course, you can. Okay, I'm not saying it's wrong, but I'm just telling you the objective criteria on the examination. Okay, what's required of you. So you will pass even if you only check the patient's identity once. And if you want to redo it again, that is fine. The only problem is, what if you're running out of time? Okay, what if you're running out of time? So next is, you may ask the patient if they have any problems with swallowing or not, and give the medication. Okay, so verbalize how many tablets you're giving. Okay, so whenever you dispense the medication, you have to say how many tablets you're giving. So the assessor would only say the paracetamol. Normally, we only have like paracetamol 500 milligrams. Of course, if it's asking you to administer 1 gram, of course, you have to give 2 tablets. You have to say that, okay? Because on the examination, the assessor will be counting how many tablets you're administering, okay? Only stat doses, so we're not doing anything on this section. PRN, so we said that we're not giving the ibuprofen yet. Question, do we need to write anything here? So let's say ibuprofen is not due yet. Are we writing anything here? Are we putting an emission code or not? So the answer is no. Okay. Remember, we only administer the PRN if the patient needs it. Okay. Probably the patient needs it, but the other problem is it's not due yet. Okay. So we are not omitting it. Okay. It's simply not due yet. So we are just leaving it blank. Okay. Similar with your temazepam, it's not needed yet. So we are just leaving it blank. Okay. So that is it. Next is your digoxin. So how are we going to document it? So if it's me giving the medication, I will just simply write my initials. Okay, that is enough. So Emmer, see, it says here, the date and signature of nurse administering the medication and the code for non-omission. So Emmer, are we not expected to write the date as well and the time? No need. Why? Because it's already written here. It says here, today, and the time is already there. Okay? Can you see it? Of course, you are not writing your initial here for tomorrow. All right? That's a good question, Benjamin. So during this station, you have the BNF. So now on the examination, you have the BNF and you will be using a tablet. Okay? A tablet. So you have like a tablet, a smart tablet or an iPad, and there is an app similar to your BNF that you could access anytime. So in case you don't know what the Joxin is, you could always grab the tablet, type the medication, and search for it. During my time, when I did my examination a couple of years ago, we had the book, the actual book. So can you imagine the horror of looking for the actual medication? Next is furosemide. We all agreed that we're giving this medication. So I only need to write my initial to indicate that I've given it. Again, the date and the time, it's already provided. Okay. Of course, you are not writing your initial here. Okay. You are not writing 1800 or let's say 16 o'clock. You are not doing that. Remember, the date and the time is also part of the prescription. And remember, the doctor are the only people who could write the prescription, not the nurse. Yeah. Unless you're a prescriber. Rivaroxaban. So for the rivaroxaban, it's not due yet. Are we writing anything here? So the answer is no, because it's simply not due yet. So we will leave it blank. Next page is our intravenous fluids. Of course, none. Just leave it blank. And drugs not administered. So do we need to write anything on this section? No. Well done. So what are the things that we only need to write in this section? The only thing that we need to write this section are the medications you are omitting. Okay? An example of which is, let's say the patient is allergic to something. Let's say the patient is allergic to amoxicillin, the penicillin, and the medication prescribed is amoxicillin. You could write the word today to indicate the date. Let's say 8 o'clock, and the drug is to say amoxicillin. And the reason is patient allergic to penicillin. And your name and your signature. Okay. So that's how you're going to write the omitted medication in this section. Okay. This is just an example, but for this drug chart, there is none. Those are the tips that I know for you to pass the examination. No questions. Okay. I will now go with the new test of competence. All right.